Now let us talk about male breast enlargement. We call it gynecomastia in our medical term. This is not very common though. Sometimes there's a false gynecomastia. Some kids are obese, and when they're growing up in the adolescent stage, that time what happens? Their whole body as such grow in size, or they're little obese. In that case, it is just the excess fat. So we have to find out it is actual gynecomastia or it is just fat. So gynecomastia means development of breast in males, in male gynecomastia. So the treatment and all this all depends on whether it is true gynecomastia or this is just false fatty growth of the obesity. Once you diagnose, the causes could be this hormonal changes in the body. Generally, when there is a growth occurs, there is that time lot of estrogen are also during puberty are also released in the male patients also, male kids. So that time there can be a little grow in the breast tissue. Best way to diagnose is, go for ultrasound. Ultrasound is the best way to diagnose a gynecomastia. Go to a specialist. If it is saying that it's a small gynecomastia or there is not much hormonal evaluation, you have to go for a hormonal evaluation. You have to see the way the secondary sexual characters are properly developing or not, the testis is normal or not, and other hormonal examinations should be done. If it is normal, in that case, if the other sexual characters are well developed, in that case we just have to wait and watch for some time. The patient is growing inside. If it is growing inside the gynecomastia, in that case we may sometimes require surgery. So if it is large gynecomastia, because it can cause psychological problems in a child, if there is a large gynecomastia, so it's a very simple surgery. You can actually go for it's a plastic surgery done, and it can be removed. The breast can be removed, the nipple and areola remains the same, and this can be bilateral, this can be unilateral, and that's why whenever the patient is having a gynecomastia, first try to find out the cause of the gynecomastia, why this child is developing breast. There can be liver function problems also, there can be hormonal changes. So find out all the reason, first treat those reasons, try to find out, and then in everything, if the patient is alright and there is no other problem, in that case a gynecomastia can be just treated by simply surgery, or sometimes it's small gynecomastia, little counseling can be done. It's not, surgery is not needed, but it is causing psychological problem. In that case, or in case of big gynecomastia, we can go for surgery, a plastic surgery, and patient can go back to normal life. That's all. Thank you.